Okay, welcome. I think we can start. Welcome everybody to this session on child benefit and child grant. I would like to ask the three panelists to join me on the stage here. So we have Madam Pepperwan, Madam Vivi, and Mr. Megasuren. Please join. Today we'll have I hope, a fantastic session over child benefit in Asia. And as from the title, we want to focus the discussion here not on theories or ideas, but on the practice. And we have here probably one of the best three countries that we have in the region that developed and went through the creation of child benefit and child grants in the region. As yesterday many people mentioned, social protection is about investment. And I really want, I'm from UNICEF, so I should start immediately very easily on a presentation about the fact that social protection is a right of children. And then probably half of you will be happy with me and half of you will be bored. So we are the Asian Development Bank. Let's keep a focus on the investment. And I would like to start with a poll, if we can. Now, I want to be a little more proactive. I know it's late in the afternoon. Some of you is like tired. You have done 2 days of PowerPoint presentations. So I ask you to take your phone and to go to that website, slido.com. Very simple. Just take out your phone. Now you're allowed to use your mobile phone, no chatting. It's for this session. Go to the slido.com and include that number, 3141. Yeah? And what you will see if, Job, can you start? I'm asking to have an opinion poll here. And the poll that I would like to have here is, when do you think then we have highest return of investment? During preschool period? During school period? Now this somebody already started, you already started answering. So if you start answering, you will see your vote. Preschool, primary school, higher education, or job training. When we have the highest level of return? Interesting, yeah. Preschool going up, job training is coming second. Higher education is coming up. Okay, 8 people, please, just vote. Vote. 15, just a couple of seconds and see who is winning here. Okay. I would say that we have a very good audience here. The right answer is preschool. The return of investment at preschool level are more than between 7 and 10%. Now, if you were a banker and you gave you the possibility to put $100 at 10% return, trust me, you will immediately jump on it. And this is what we know about investing in early period of life. And why is that? Because on the first 3 years, on the first 1,000 days, is where we have 90% of the preparation of your brain, of your synapses. What happened during the first 3 years of life is what will set your capital, your cognitive capital, for the rest of your life. And for any reason, because you don't have nutrition, because you have bad health, because your parents cannot stay with you, because you're going through major problems, you go through some shocks, then your brain will not develop at the maximum of the potential. And we have to be very, and again, this is not opinion, this is brain, people that measure these things with the electrodes and look at the stuff. And we have to remember that it's a short window. 1,000 days is nothing. And it's a window that doesn't come back. There's a big difference between doing investment in a road and investing with children. In a road, if today you don't have the money, you can wait a year and maybe next year build 2 roads. But with a child, if you miss the first 1,000 days, there is no chance you can go back. If a child doesn't have food today or for a year, you cannot give them the double of the food in 2 years. Doesn't make any sense, correct? So every opportunity lost now is lost. When I have to explain this one sometimes to Minister of Finances, I'm used to say that in social protection with children, 1 plus 1, food today and tomorrow, is different than 0 plus 2. Because you cannot give the double later. And this is why the first 1,000 days are so important. And this is what we'll hear later from our panelists, the importance of that. And why it's so important for our region is because if you think about all the discussion we had yesterday about growth and economic growth and the fourth industrial revolution, well, the power of the future of the country is based on the capacity of innovation that your children and the people of this region will have in 30 years. And not only because that really depends on the growth, but probably should be also a little more, I can say, self-centered and thinking about those children that are born in today in the hospital around the region are the ones that will pay our pension in 20 years. And most of you, 20 years, you will be all retired. So if you are not doing for children, do it for yourself. Is that if we miss people, then we will have a problem. And in an aging society like Southeast Asia, it's important to think about pension, of course. But if at that time every single child will have the burden of more people than they have today, you cannot lose a single one, as in the video that we showed before. That is also an important issue that we debated in the previous panel and also in the video, is the fact that when we design and we look at child grant and we look at the social protection for children, there are two issues that we are very concerned. As I said, if the point is not leaving a single behind. One is to make sure that every child has the same possibility to enter in the system if they need it so. And that means we have to be very careful when we design our program to focus on what we call the exclusion error. Before we had a very long discussion, so if you were here before on the health session, you know what it is about. But you know that in social protection we can make two major mistakes, two major errors. We can make inclusion error. That means we give grant to people that should not receive it because they don't need it. This is called inclusion error. Usually Minister of Finance is very concerned about that. Or you can make exclusion error. That means that people that have all the rights, according to your design, to receive the grant for multiple reasons are not receiving it. Now, the two are not, it's not so simple that if you decrease inclusion error, you also increase exclusion error. It's not the case. On the contrary, when you design a program, if you want to decrease the inclusion error, you have to put a lot of control. You want to check every single household exactly is under the poverty line in that moment and also in the future, as we heard from the video before. Exclusion error, you want to see why some children didn't have the chance to receive the grant that they were entitled. And what we are learning more, and it's important that sometimes when we speak about error, we think about small things. Well, exclusion error in many programs around the world can reach sometimes 30 or 40%. Then many means a little less than half of the kids that should receive it are not receiving it. And the worst one is that in many cases, this exclusion error is not just a random event, like a lottery. What we discover when you do real studies is that there are some specific group of children around your countries that are always excluded, systematically excluded. Because, and this every country is different, but we have countries where they were excluded because they didn't speak the language, because they didn't have a radio, because they were not affiliated to the party, because they lived too far away. So when we design child grant, if you want to decrease the inclusion error, the Minister of Finance concerned, don't waste money, you have to put a lot of control. If you're concerned about exclusion error, don't waste people. You want to make design as simple as possible. You want to make sure that even that household is the last one, far away, don't speak the languages, a different ethnic group, maybe not affiliated to the same leading party or having a different religion, still has the chance to have access to the child grant. And that is another point that I would like to focus, is that when we work at children and child grant, we are based on the Convention of the Right of the Child. There's a fantastic principle that is called the best interest of the child. And many means we don't have ideology. We know there are different options in targeting, in designing, in components. What is good is whatever is proven that is better for children. If you design and you have data that show that impact is what you wanted, that children are entering and nobody systematically excluded, doesn't matter what is the design you choose, that is the right one. So it's not about ideology or opinion or assumptions, it's about evidence. And here I have to say this part of the world probably is a little behind the rest of the world. In the past, in Latin America, we had a lot of information. The first round of randomized controlled trial impact evaluation were done in Latin America. Then we had a huge amount of research in Africa. East Asia and Pacific, compared with Africa and Latin America, is really, really behind. Still, we have a lot of programs and decisions that are based on assumptions, repeated maybe many times, but not on real evidence. Another point, just to summarize, when we design child grant, is that always to remember that design for the poor doesn't mean that you have to make a poor design. What I want to say is that designing a child grant is complicated. It's probably the most complicated one among all the social protection intervention. Why? Because think for a second. If you have a child grant of 2 years, and as in many cases, it takes a year and a half to register a family, by the time the children is entering, it's already time to go out. It's a system that requires you to register people regularly, as soon as they are born. In many cases, even before, when the mother is pregnant, to support the pregnancy. It's a system that requires payment to be done on time and regularly. Because if, as we heard, in many countries, one of the objectives is, for example, reducing malnutrition, you have to give money regularly to allow the mother to buy food. Because, and I'm an economist, there's a big difference between giving $10 every month or giving $120 at the end of the year. If I give you $120, you buy a bike. If I give you $10 a month, you buy food. It's a different propensity of consumption, it's called. Now, the design need a level of efficiency that sometimes is very difficult to reach. Second point is that we have learned from the hard side that cash is not enough. Cash with children is not enough to make the major results. And nutrition, again, is one of fantastic examples. You can have more money, but evidence shows us it's not enough to change the data on stunting and wasting for children. And the reason is because the needs of children the first 3 years or the first 1,000 days is not just the cash, but it's how that cash can allow the mother to have access to the health services, to the social worker services, to a better condition of life, to consumption, to buy proper food, to know how to cook the food. Is much more than that. The cash sometimes is the incentive to have access to the services. But remember, cash is not enough. But also, on the positive side, remember that with child grant, as in many of social protection, we have amazing externalities. That means when the family entering the cash grant, the possibility to have some resources allows them to do amazing results for children. We even had countries where the cost to collect the money is higher than the money itself. So there are places where actually travel and reach the village and collect $10, if you calculate the direct cost and indirect cost, the opportunity cost, is $12, $13. So it's like, wait a second, it costs more than the money I have, and still we have positive results for children because the mother can have access to different services. They reach a place where there's a better food, where the better knowledge, different kind of products. So we have to think a little more. Now, and the last one, what we're missing, it's one introduction, is that we heard a lot about fiscal space. This is the usual debate. Oh yeah, nice idea. Well done, UNICEF. Well done, Minister of Social Welfare. Unfortunately, we don't have the money. This is usually what happens sometimes with the Minister of Finance. Well, I think we have to remember that in fiscal decision, how the budget is done is not residual. When you're an investor and you find a new investment, you don't say, I've done all my investment, I cannot touch them. If you find a good opportunity, you readjust your investment, correct? It's the same what happens every year when a budget is done at the government level. And you have to remember that probably instead of speaking about fiscal space for social protection for children, you have to speak about political space. A budget is not a mathematical decision. Despite the fact that I'm an economist, I would like to pretend, but it's not true. A budget is a political decision. And sometimes we are challenged by our Minister of Finance. Where is the return of investment on social protection? Where is the impact? And we spend so much money and so much effort to do randomized controlled trial, 3 years, and we come with regressions and a lot of statistics. And I've done that one. And then one day I realized, but when our Minister of Finance go to the Minister of Defense asking the return of investment of military expenses, they don't do it, correct? It's a political decision. So building a political space is probably the most important things we can do to build social protection for children. And here, today, we have 3 fantastic champions for that. So we try to do a kind of talk show, a little. We want to keep you awake, and we know that it's tough. So I will start asking a first set of questions, allowing each of the participants to answer. And then we do a second round, and then you have or your app, or you can even use Lido to ask the questions. So we want to really to keep you participating, and we'll ask your question at the end. And then, so I will stop talking now, and then finally we go here. So I would like to ask, starting with Madam Vivi. Indonesia has an amazing big programs, it's a great countries, a lot of resources, but you managed to develop something quite exceptional. Can you tell us more about how you managed to do so, how you managed to create the interest, the support, and how you manage also the complexity of Indonesia in developing the different child grants? But over to you.
Okay, thank you, Andrea. But before answering, can I say something about the intro? I think, thank you for a nice introduction. I'm a mother of 3 children. I went to study. I went to US for study about 6 years and bring my daughter, my daughter at that time. Then my second child was born there, and I left them to my mother. The third one, I grew up by my own. So I really see the difference and do understand about the question you pose, what we have the highest rate of return. So time is sensitive when we are talking about investing on children. Time is limited, and we cannot return it back to the time that we have. So sensitivity of the issue or the urgency of the issue is really important. You already mentioned about the political will is the key. The recent report of the World Bank mentioned that around 54% of the workers in Indonesia have experience of stunting. So you can see now that the government of Indonesia really struggle to tackling of the issue on the human capital, particularly on the quality issue. We in staging could expand the coverage of any programs, education, health, and the social protection. But speaking of the quality, again, we cannot rewind the time. So we don't want to have this kind of experience in the future. The political will, again, bring the sense of urgency, not only at the president level, but at local leaders is important, as well as other components of communities.
Yes. I will also come back on the experience of Indonesia later. So we'd like to move to Mongolia. And I think it would be very interesting to hear from your experience in Mongolia, what are the key elements and institutional arrangement that the child grant in Mongolia has that allows you to reach children in the most remote and the most difficult areas? Because if they can reach children in Mongolia in winter, trust me, you can reach all your children everywhere in the region. But please.
Thank you. So, good afternoon, everyone. Thanks for the question. And so Mongolia is one of the most sparsely populated country in the world, and then got huge rugged terrain, and then so we have lots of destination too hard to reach, and then we made if you compare to a few years ago, we made lots of advantages. For example, internet coverage in every village, and then almost every herder's got a mobile phone, and then they do mobile banking. And then also, we do have the MIS system in every village, like we call SOM. And then also we got on regional level. So we just do banking because in Mongolia has 330 SOM. You can understand the small villages, and then every village got banking, and then they can cash transfer from the bank or through the internet banking. So this is the most developed feature in the last years.
So the integration of infrastructure, specific infrastructure that is delocalized at an individual village level,
Yeah,
so they
exactly.
can have access.
Yes.
Okay,
Yeah.
fantastic. To Thailand. I think Thailand, for the Chai Grant, is probably the most interesting part is how you manage to expand the program in Thailand. I don't know if you know, but Thailand started, first there was a 0 to 2, and then 0 to 1, and then 0 to 3, and now 0 to 6. How you manage that? And when you want to stop? Where do you want to go?
Where we want to go. Good afternoon, everybody. Thailand, about the expansion of the Child Support Grant. We first start last 4 year, 2015. At the beginning, the government said this grant will give to the newborn in the poor or near poor family for $12 a month for 1 year or 12 months. At that time, it sounded like why it's so short. Anyhow, we start. But before we start this, we have many study on the benefit of this project before the government adopt this project. Right after the government adopt this project, just only 1 year. 1 year is too short to have the evaluation on the impact. So we have the rapid assessment on the project around 6-7 months. We have the rapid assessment, which we found that around 20% of the mother of the newborn in this project is teenager mother. And mostly the money they spend on the newborn. This is a rapid assessment. So we show this to the government, and that is coming to the first expansion. First expansion is longer, to 3 years. At first only 1 year to 3 years, and also from $12 a month to $20 a month. But the definition of the poor or near poor is the same. The poor and the near poor in the definition at the first time is annual income threshold is $1,200 per capita. The first expansion definition of the poor is the same. Right after that, the first expansion is happened on the 2016. Right after that, on the 2018, we have what we call impact evaluation and targeting assessment. We have it last year, and we found that the children in the project, in the program, have more positive nutrition outcome and have more breastfeeding more than 6 months and can access to the other social services comparing with the children in the same socio-economic status but not in the program. So this is evidence-based to show to the government. And also the targeting assessment, we found that the exclusion error is around 30%, 30%, which is somehow they said is acceptable compared with the other country. But the finding of the evaluation and assessment, the government have the second expansion this year. First is expand more time from 3 years to 6 years. But money allowance per month is the same, $20. But to cover the exclusion error, the definition of the poor and near poor is higher. The annual income threshold from $1,200 is up to $3,300. So we hope that this can cover more the exclusion error. As you saw the video presentation before we sitting here, that is talking about the exclusion error. The people say why they don't get the money and so on, what happened. Sometimes it's not very clear about the income, so they don't get, that is a problem. So this is very short what we have learned for more than 4 years. I have to say it in a limited of time. But what we learned from the step by step of the expansion, from my experience, from Thailand experience, I think when we talk about the universal, like Andrea said before, universal is easy to work for the practitioner. You don't have too many work to see this is poor or not poor, but it spend big money. We can start at the beginning and not jump to the universal. We can go step by step. At first time, we just say it's 1 year, and it look like funny. How come you give them for 1 year? Is it cover your 1,000 day of a very good day of the open the window of opportunity? We better start than never, from zero or from the beginning by targeting. And we have the evidence base. We have a study, we have the monitoring and evaluation to give more the evidence to let the government know. And the government could be the good governance to make a decision with the evidence base. This could be like a lesson learned. But some problem or some challenges we face with maybe will not happen in your country. The other one, if I can lesson learn, if I can go back, I will decide about the database or information system for the management information system, MIS. At first, we don't think about this much, but we think about it, but not big enough. We think it's around 500,000 children will be in this program, but right now it's around 1 million. So the system is slow and have some kind of delay entry the data from the local. So it means delay for the payment also. And one more thing, the lesson learned, we work like we have a participation among the stakeholders. It's not Ministry of Social Development and Human Security who ask for the government for this project alone who can do this, but we have to collaborate with the other ministry to help and work together, and also the NGO or like a UNICEF, like a Thailand Development Research Institute, or academic from the university to help us, to take a look, to give us a suggestion, and to work together. This is a lesson learned what I got.
Thank you. We are entering now in the lesson learned kind of discussion. And the idea is to think about, based on these experiences, imagine that we have to create a new child grant. What are the things we should do and not do? And for this one, again, I can see the energy, so I want to energize you a little more. Take again your mobile phone. And I would like to do, now you have just to write one word. And if you can write, what do you think, just wait the next one. What do you think is the major challenge in designing a child grant? In one word. Just write it down. What do you think is more important at any level? Let's see if it works. You write it down your answer and click submit. Okay. From the design to the implementation to the relations. Okay. You can repeat words if you want. Whatever you think is more important. Okay. You should see on your back the words popping up. Okay. And you can keep, will remain open, so you can keep writing what you think is the major challenge or the things we have to take in consideration when we design a child grant. But I would like to go back to Mongolia and asking the same what the Clean Thailand was mentioning. Based on your experience, based on the challenge that you had in Mongolia through all these years, what is your recommendations, what your suggestions, or your lesson learned, or what you would do differently if you can go back in time?
Thanks. So I saw all the words on the screen. It's you need to consider, and then this is Mongolia has experience since 2005, almost more than 10 years experience on child money program, and then we implemented in two different ways of child money program implementation, like conditional, unconditional, universal, or based on PMT survey on also. So from these, I do agree. It's first the issue is very high on political agenda, and then the politicians make it use it as a political tool. I do agree, and then also the implementation and the for the other countries affordability. Can you afford the money or the program? For how long and for the size of the beneficiaries? And then if you see size of the beneficiaries, for example in Mongolia now is the budget of the child money program is half of the budget of the whole social welfare programs. So it's a really huge amount of role plays over there. And then, so size of beneficiaries, and then if you choose this size, how you targeting is the second question, and how you going to target the beneficiaries. And then, so I said it was universal, and then after since 2017, we had as economical downturn, economical problem, and then we need to get support from International Monetary Fund, and then it was the condition under that program. We need to cut universal programs of social welfare, and then it was one of them was a child money program, and then we cut to drop to until 60% of the whole children, And then after 1 year, the economy experienced increase, and then the government decided to increase the amount of the children. And then now, after that, increased to 80% of the children, and now it's 85. And we are increasing the amounts. So the targeting. And then universal, if you implement that program targeting universally, it's easy to implement. It's like every children or something. But if you like targeting 60 or 80% based on PMT, and then it's comes lots of social coherence. For example, if you received the child money for 2-3 years, and after stop the money, and then it will be lots of application, grievance mechanism, and then the lots of burden on our specialists who work on some village level or in different areas. So if you want to, I heard the experience of Thailand. Maybe it's better to beginning from the small, and then you can go up the size or something. And then, that's the another problem. Second one is maybe the other way we need to, how you target, maybe geographically or by the age, or, is maybe combined, both of them, maybe number of the kids in household, something. This should be another way to target. It's easy to implement. Otherwise, choosing who is the right one is, you mentioned already, the exclusion, inclusive error, and there is lots of burden. And then on this issue, we need the research. And I cannot say, which one is was best, but we need to that because we experience it all of this way, and then we need to now the data collection and how to research again. And this was my recommendation.
Thank you. And I think the experiences in Mongolia is really amazing. What happened? Challenging also. I may assume also difficult. And something that I forgot before, but Mongolia is one of the cases where sometimes the issue is that we have resources when we don't need it. The Minister of Finance is ready to give you more money for social protection when there is economic growth, when there is additional resources. But if you think for a second, when we really need social protection is when we have economic crisis. Is when we have economic crisis that the poor family or the family at limit, we need that kind of support. Economic reset is counter-cyclical. Social protection should be counter-cyclical. And this is when we as UNICEF and colleagues, we have to work with the IMF colleagues, we keep repeating, we need more money on social protection when there is less money in the economy. Social protection is not a gift that you give us when there is the extractive industries or the coal or the oil, or when we win the lottery. If a family wins the lottery, they don't need more money, correct? When they need money and support is when there is a crisis. This is what social protection is about. It's helping in the moment of crisis. Now, advocating for counter-cyclical social protection, we know that is tough, but we should be good in mentioning the investment in terms of is the only way not to lose all the investment you've done before. And that's the point. But let's continue with Indonesia. What is the lesson learned from Indonesia? What you do differently, or what you can suggest?
Indonesia social protection is actually quite comprehensive, but because we cover so many people, there have been always a challenge about the under coverage and also the adequacy. So in terms of coveraging, like I already and maybe several colleagues already mentioned about the unified database, we start has been like now more than 10 years developing a database uh, which has both family based and also outside family. So for example, currently we could mention that for the 40% lowest income group, we have around 31.4 million families are vulnerable, not only the poor one. In addition to that, we could count around 700,000 children are outside of the family. The same database. We know exactly where they are, the roster of the families, and also the conditions. Then we could design the social protection program as well as the other complementing programs, particularly focus on children. However, it's not enough. Still, for under coverage, we need a hand of the local government, be it at the provincial as well as the district, to do the verification, the validation every time for newborn baby, the ones that are just getting into the country, or migrants who have pregnant outside the country and so on. So the database need to be updated, need to be verified and so on. Our hands at the central level cannot reach all of them. So that's why we need to build, or we have built a mechanism of updating in regular basis. In addition to that, for certain regions, we ask them to optimize the funding, including specific funding for specific regions, like in Aceh and Papua. They have quite a lot for social protection, particularly for the kids. So for these two regions, the Papua and also the Aceh one, complementing the national programs like CCT, early childhood programs, scholarships, and many other, like integrating stunting programs and so on. They complementing with their own program. Of course, we help them to design the program, but this is focusing on the children's, for example, in Aceh up until 6 years old, and in Papua up until 4 years old, particularly to improve their nutrition, their health condition, and also changing the behavior. Somehow, coaching or implementation is other tricky part. So beside the adequacy that I mentioned need to be complementing not only from the central but also from the local sources. Implementation is other tricky part. So coaching the same messages, building what is it? Learning curve, the same from region to region is important. So for example, through CCT, we also develop a e-learning for all the facilitators, around 40,000 facilitators, 60% online, 40% offline, just to deliver a module about mainly on children and family welfare. There are 4 actually for module, for health, parenting education, child protection, as well as how to start the businesses. So through this kind of thing, coaching, learning is part of the things that could help also process of changing behavior toward a positive things. On the fiscal space, of course, like other countries, we're experiencing a big challenge in this regard. We now trying to explore new innovative, I would say, innovative way of funding For example, we now working with the UNICEF in Indonesia, working with several impact investor for development impact bond for preventing family separation. So the idea is utilizing a seed money from the investor to develop an indicators, collaborate, which are the programs that could work well and measurable, then see the impact. By having this, we could sell the idea, the business process, the impact toward funder that or sell it as a bond to get more funding, of course going back to the benefit for children. Other things that's also going on is at the national level is the net finance, but this is for the SDGs, which is some goals I believe relate to the children benefit as well.
Thanks so much. That was the first round. Now, what I would like you and us to move on the possibility to ask question. Now, you can still use the app as you've done, or you can use the one you have to ask questions and to vote for the questions, and the panelists will pick some of the questions that will pop up over there. Is ready there? Okay. In the meantime, I want to follow up on, thanks so much. And really, here you have really 3 amazing countries. Something that I learned from Indonesia is, thanks to that database and the level of knowledge in Indonesia, they also were able to see that, and something that sounds obvious but we never think about, is that poverty is not a static characteristic. Being poor or being extreme poor is not like having blue eyes. It's a dynamic thing. And families keep coming in and going out through the same time. When you really look at the situation, really depending when you measure, a family can be above the poverty line, nearby the poverty line, very low the poverty line. Just think about depending on the weather, depending on your job market, depending on specific areas. And sometimes we design programs under the hidden assumption that poverty is a characteristic, that this family will be poor forever. And it's not the case. They can go out, but then they can fall back. And when we had, by the way, you have some material on your chair, not because it's just UNICEF marketing, because you have a snapshot of the 3 programs here on these 2 pages. So if you want to know, like, the basic are here. But it's that part I think is important. It's designing. And then we can start seeing, please write questions and vote for the others. A second point that it was mentioned is the fact that I think we went from Thailand, the fact that it's not just the Ministry of Social Welfare, but if you want to make a proper social protection, it's about many ministries. When you look at the fact that it's not just the cash, but the entire welfare and care, it requires a level of coordination that sometimes is tough, particularly when the ministry is not used or there is no such a traditional capacity. But without coordination, the risk is that we just go into a duplication of efforts. Let's see. Okay. Let's start. We got 2 questions. Only 2 questions? Write new one, and then they can pick the question they want to answer. I'm not suggesting anyone. But who want to answer one of these 2 or 3?
Because it's also related to the points that you make about the dynamic of poverty. That's why we collect the data is up until the 40% lowest income group. It's not necessarily the poor one. For example, our CCT now up until the percentile of 20. So it's around 10 million people. 10 million families. So how to ensure that the family, the 10 million family, which is the 20% income, lowest income group, their children has an access to the health and education. Not only access, but also the quality of life. That's why we believe, I mean, there are a couple of impact evaluation showed conditionality, it's really help to change the behavior. So it's not about money, but how to increase the value of the money itself. The money maybe is not what is it? Uh, Comparing to the time they have to go to school instead of going to to the street to find money, maybe it's uncomparable. But the value where they send the kids, then the mother really understand the goodness of the school. They could help the children with their homework. They could see that the children cannot be like themselves. The vision about what the children supposed to be, the vision, I think cannot be gotten if we don't give them like through family development session, peer-to-peer, and several other information. Think about the family live in one island in Papua. They don't have any enough electricity in long day. So when they have an access through through their cell phone, and the ones that they access is the negative one, it's a doomsday for Indonesia if we have something like that. So for me, the conditionality is important, particularly when we are talking about targets of the lowest income group as well as in remote places. This for sure about changing behavior toward the positive livelihood.
I have to be the hard talk here. So I like this answer, but sometimes you have to be think about which word we use. Conditionality means, so I think is important, is linked with the idea that cash is not enough, correct? Is the services, is the change in behavior, access to services, access to community, and creating that incentive. This is what really makes social protection different from the simple bank transfer. But conditionality means also that if a family, this was the original idea back to Latin America, if you don't comply, you get kicked out. But it's not, right? The interesting thing, we still use the word conditionality, but when we start looking at how many children have been kicked out because they were not complying, and then we discover that children are not kicked out. So conditionality is something that sometimes you have to sell at political level because people don't like the idea to give money to the poor, some people, or there's like, I give you the money if you do something. But in reality, when we talk about child grant, there are almost no child grant in the world that actually kick out children. So even if we call conditionality, at the end is what you can call it soft conditionality, but in practice is a care, is a welfare system, is a cash plus care, is cash plus case management. And in a way to say is that because if a family is not sending the children, they're not coming for vaccination, for example. A conditionality will mean if you don't vaccinate your child, you don't receive the money. What's happening in reality, if a family is not sending the child for the vaccination, in most of the cases, we do an extra visit to the family. So yes, the conditionality was there, but the real action from the system with children is not to kick them out, as we have with employment schemes and with all that. That's different. But with children, actually, we give more services at the end. So we have to be careful, not careful. Let's call whatever we want, and sometimes so the Minister of Finance is happy or somebody else is happy. But their practice is that never should happen that a child is kicked out because they are not complying. Because if a mother is not able to provide feeding, coming to a training or doing vaccination or doing postnatal care, there must be a reason. And before kicking them out, we want to understand the reason. In most of the cases, when they don't comply, it's because they have extra need. They need the social protection program even more than the others. And so in that sense, this is why I'm not, even if I'm UNICEF, I don't react when we call that conditional cash transfer. I don't really care about the language. I always ask, how many children have been kicked out? If none has been kicked out, call it whatever you want. Huh? I have no problem with that. The important is that we don't punish poor people because we don't comply. Sometimes we also have to be honest. How many activities we ask the families, the mothers to do that are absolutely irrelevant? And we have to be honest. This is why the data is so important. Is that coming to that training on cooking is really making a difference? Are we monitoring them? Or are we just forcing them to pay a cost to get our support? But I have to say that I'm new in this region. But as far as I know, children are not kicked out, despite the way the program are called. So let's not react. Let's look at the data.
I would like to add up for Andrea what you have said. This is that's why Thailand don't have the CCT, conditioning cash transfer. We just at the beginning, when you register, you're supposed to have a pink book, which is a book for the mother and child. At least you access to the public health. That's all. Right after that, we don't have any condition like that to kick the children out of the program. I think this what Andrea has addressed is about the sharing the information. We can share this information to the public health volunteer in the village to know where the child with this grant is, so they can go follow up and home visit and give the counseling and so on. This is the answer of the condition and unconditional is the answer. And to answer the first one, that cash is not enough. Cash is not enough. What else? What else is about the sharing the information among the social services of your country? What the services you have? So if you share this information, the children in the project get the money is very little, and there you can have one glass of wine only for $20. But it's meaningful for the poor, and also it's like a navigator to say where the vulnerable children is in where they are in the village. So the social services in the other area will go down there. And also there are one more question about the children with disability. Same, we get the same. But what the top up for the children with disability, they have another scheme of the social protection, like they have the allowance for the person with disability, and also they can get the early intervention and so on, many. But for the child support grant in Thailand, we get the same.
So we do have the extras allowance and then services for disability children, children with disabilities, and then almost 10 allowances and services we do provide from the state free, like the budget of free wheelchair or something, the special equipments we provide from the state. And so why Mongolia scaled back to universal program to target it. And then I explained also, Andrea also mentioned already, we experienced the economic problem, and there is two big parties in Mongolia, and both of them, they want to give the money for all children. It means universal program, and then, but because of the economical condition, Mongolia is very vulnerable of the foreign commodity shocks, and then if the commodity price is down and then the economy goes. For example, in 2011, we experienced the increase of GDP like 17.5%, but from the year 2014 we experienced downturn, and then the survey on property shows 2016 increased by 8%, and it was 29.6%, and then the child poverty was nearly 40%, and then that's the thing because of the context of the state.
Thanks for that. And I think there is important things that sometimes we forget. Social protection is about poverty and about vulnerabilities. But we know very well that poverty is not just monetary. Poverty, if you just measure poverty by the amount of money that you have in your pocket, is not enough to describe poverty. We know that poverty is multidimensional. We know that poverty is about deprivations. And the same is social protection when we try to intervene. So the idea, there was a question about the cash. If cash is not enough, what is the rest? The rest is actually addressing the deprivation, addressing the access to services. Sometimes the cash, that small amount, is exactly that small amount that allow the family to do the extra mile to reach the services, to get that services otherwise they would never get. It's a very good question, like, okay, but if you have $100, what you do? You give $1 to 100 people, or you give $50 to 2 people, more or less. This is the always useful kind of, we give small to a lot of people, or we give a lot to few. The reality should be based on the evidence, what is meaningful, because if you go on something that is more expensive to collect, then we're asking poor people to take a cost. But at the same time, the amount that we want to give is not to take out people from poverty just from an external result. It's not, otherwise it's just fictional, correct? The best answer is do your research, do your math, know your poor people, know your country, see what is really relevant. Because sometimes it's even not the cash, it's something else they need. Think about when you have ethnic minorities, when you have people that move within the countries, or you have migrants within your countries. There are problems that are not necessarily economic problems, but those are the biggest pocket of vulnerabilities. So it doesn't exist a solution for everybody, but should be based on evidence, not just assumptions. And not, as I said before, not just ideology. Now, we use all the first 2 rounds, 3 rounds of questions. We still have minutes. I would like now to open. If you want to say, or you want to hear your voice also. So if you want to raise your hands and having a question, please, questions that usually end with a question mark, so we can have additional round. But we just want to open the floor to anybody who has comments or questions. Otherwise, I will start asking you questions through this. Any question? Yes, please. And introduce yourself. Or you can, yeah.
This is Muhammad Iqbal Hussain from Bangladesh, and I am Joint Secretary to the Ministry of Women and Children Affairs. My question is to the 3 panelists. Now, what should be done? What is the modality of transferring cash to the children? It is on monthly basis, or quarterly basis, or half-yearly basis? And what is the criteria of selecting the poor mother and children? And I want to know from 3 of you. Thank you.
Transfer the money for Thailand, we transfer via the bank account to the caregiver, not only mother. Because in fact, sometimes mother is somewhere else working, and the children, the child, is in the village with auntie, grandma. So we transfer the cash by bank account. And also some cases, they get the cash but they have to come to the officer. So it takes a long way. Anyhow, it depends. They can choose themselves, but normally, mostly, 97% they take from the bank account. And the second question, monthly.
So in Mongolia, we transfer child money through the bank, and then the beneficiaries can select their own bank. We got 14 banks, and then they can choose or connect their accounts with their username. And then we transfer monthly. So in additional, I can say the households who is poor or under poverty line, the research says the child money is for some households is, the income plays big role. If it's delays, they are struggling, buying foods and something, and that's why we try to get appeal grievance mechanism works well and updating every time, and then it's monthly base.
We also have the same mechanism go through the bank. For CCT, they goes to a mother account, but for scholarship, it's on the children account because they could create a student saving account. For areas like Papua, who have difficulties in terms of access, we assign kind of like what we call it as a discretion policy. So we set, this is go through the bank, but offline. We call it the offline payment. Yeah, so the bank decided the date, and then the day, usually we call it as a market day, every 3 months, and also the location. So using like the EDC or the mobile ATM, the bank will go to the community for transfer the money.
Is there any occasion where children or the families receive benefits from one program, but then somehow they disqualify the others? For example, I'm sure that there are many programs that children and families are entitled to. For example, if you have a child with a disability, for example, in Thailand, you get also the disability allowance. But does it mean that you have to give up the child grant support or not? This is a question for all the panelists. Thank you.
For Thailand, each kind of grant is different objectives, so they can get 2 or 3. It depends on when they meet the qualification, they get all of it.
Basically, we don't disqualify when somebody already have another grant. Yeah, the idea is actually complementing, because to compensate the cost, for example, for the family with the person with children with disability. Starting in 2016, our CCT has a component for the disabled children. This is very significant for us because by having the condition, the component of condition of children with disability in the CCT, little by little we collect data about where they are and what are the conditions. It helps us to improve the supply side. In previous time, in many cases, the children with disabilities are hidden by the family. So there are many cases about a supply, be it at the health as well as on the education. And we have a policy for inclusive schools, but in the implementation, big gap on that. So by include the children with disability as a component of the CCT, little by little, we also working together with the local government to improve the supply side.
Any other question? Yes, please.
Yeah, I had one question. I'm Disa Sjöblom, Regional Advisor with Save the Children on social protection. I was just keen to know, since we're talking about child grants and child benefits, what outcomes are the programs looking at? What outcomes for children?
Outcome and impact. Maybe we look at the age appropriate development. By 1 year you have to do this and that, 2 years we have to screen for the what we call age appropriate development. Is that? Mm-hmm.
So same as Thailand is first aim of the child money is nutrition and food, and also some politicians explain because the Mongolia has a very tiny population, only 3.2 million, and then they say this is the supporting the increasing the population kind of support for a political measure. And then but from the perspective of the social welfare, this is certainly the reducing the poverty on child poverty, and also the important for child nutrition.
I think we should also think about improving the quality of the human capital of the future generation, ensuring that no one left behind as the next generation, and don't experience of what we call as a revolving door, or back again to the poverty, or intergenerational poverty. Don't see anymore by 2030.
That's a fantastic question, because, and I want to be provocative a little, sometimes we define what is the objective of a social protection intervention. But if you think for a second, the essence of the use of cash, and is this idea that when you give cash, you trust the single family to take the decision about what is more important for the family. And sometimes we may have a problem with nutrition, and we won't really want to make results on nutrition, without realizing that the essence of social protection and cash transfer is that giving money to the family, and the family decide what is more important for them at that time. Maybe not nutrition, maybe something else. And I know this is a really big shift in our mind, particularly when we work in development, is not us defining what are the only elements, the only priorities, but trusting families and fathers and mothers. They will decide in each of the case, doing a real case management, what is more important for their children. And because sometimes maybe we don't reach the objective, and trust me, as UNICEF we always do that, is we are not reaching the objective that we wanted, but doesn't mean there was not our impact. And that doesn't mean that the impact we achieved was the best impact at that time. And I think that is something that is really like a little revolutionary in the use of cash in doing development, because you'll really empower at the end the family to take the decision. There's a big difference between giving cash and giving a voucher, where you say you can only spend this money for this, because in a way that is cheating, you're forcing people to do an impact on the objective you think is important, and maybe is not important for the poor. And that is something that I personally like a lot. It's based on the assumption that poor can be poor, but they're not stupid at all. And poor can be poor, but they do care of their own children. And they know their reality better than I do, better we do sitting in our ministries. Then we have to find a balance. But trust me, the power of cash is that. Probably too much economics here, but really it's much more than the major things. And the important is to make sure that we measure the outcomes. that we go beyond our outcomes, what we think was our priority in our 5 years plan or in our programs or in our things. And then we discovered that the externalities and the impact are really amazing. And also we have to be humble. Sometimes we want to see an impact in the time that we have, 2 years, 1 year, without realizing that most of the time the impact that will be left for children is in 20 years, in 30 years. Because what happened to a child when it was 0-3, we will see the real impact probably when the child will, after universities, when we start working, when he will start being the innovator that we are looking for. None of us will be there. But that will be probably the real impact that we have. And that is, sometimes you have to be humble a little. Any other question? I want to give you a last word to each of you, one thing that you would like to tell to the public here about Child Grant. Anything. It can be a suggestion, it can be a dream, it can be a reflection, it can be just one word. Last round.
Cash alone is nothing. It's not big matter. But the database, the information should be linked between the other social services to give more and more services to this group, because this is targeting. Like mother, if we have a teenager mother, she will not reproduce one more child with the vulnerable. What kind of project or activity we can do with this group of mothers, like get more higher education or employment or vocational training, so she will be out of the vulnerable group and not reproduce again. For the children, we can connect, we can link the information to the other services like public health or education and more and more. And this Thailand, we tried the pilot project and we will launch widely in the future.
Okay. So I would like to mention the outcome of the research. And then it says the child money in Mongolia plays a big role to reduce allowance the poverty, and also it plays big role, especially for the vulnerable groups of the society. It plays big role for nutrition and education for the children, and then we cannot assume how much the economical return in after a few years time or many years, and then this is very important program, I guess.
Maybe 3 points. First is better quality of life. Second is robust MIS, database and MIS. Third is agile process and effective implementation.
A big applause to the fantastic panel. Thank you so much. Have we finished? 4 minutes in advance. As I said, you have some material in your desk. You have the descriptions, and you have, if you like paper, take with you. If you don't like paper, everything is online in the app.